Hi everyone, Dr. Nemechek here. I want to discuss cervical cranio instability. This thing that's being talked about more and more. They're kind of saying, oh, you just got loose tissue and you maybe have Ehlers-Danlos syndrome, EDS, and your neck is unstable because of the, people with EDS, they've got laxity in their joints so they can dislocate fingers and their elbows and things like that kind of easily. So just to make things clear, EDS is real. Those things happen. Okay? This craniocervical instability from EDS, doesn't happen. Okay? Certainly not the way everybody's talking about. And I hear these people over and over, and they're going to see somebody, often it's like chiropractor, and they've got some manipulation they're doing for craniocervical instability. Okay, let's just kind of take this down to really what this is. Okay, here's cranial, brain, skull, cervical spine, that's the upper part of the spine, instability, okay, means it's unstable and things slip here, okay? See this? That's your brain stem. This is a medical emergency. This is why when you see like a football player injured or somebody in a car wreck injured and they put the collar on their neck, they're making sure they don't have a fracture causing instability here, because you can become a quadriplegic. Okay? And yet alone when you're all the way up here at C1, right up in here is areas that control your breathing. Okay? So no doctor in their right mind, if they think you have this slippage here, should be manipulating this area until you have x-rays that show that you don't. All right? So it's a bunch of nonsense, the CCI from EDS. Again, EDS is real. You can have a bunch of symptoms from that. But thinking you have craniocervical instability from that, it's from trauma. It's from a car wreck. It's from falling out of off the roof. It's from things like that. Okay? And again, that's why you're on a board. That's why they got the collar on you. They're making sure your spine's okay. Because if you have any instability here or anywhere in the spine, it's going to damage your spinal cord and you're going to be paralyzed. All right? Okay. And I've seen a whole bunch of these people come in. And typically, what do they have? These people have damage to their autonomic nervous system. All right? And typically it's a buildup over time of several injuries, what I call cumulative brain injury, and there's other videos on that. But mechanically, the two main mechanical things that go wrong in people with autonomic dysfunction is, one, the intestinal tract slows down, so they got dysphagia or reflux or heartburn or bloating or constipation. And the other is improper, you have low blood pressure above the shoulders. Okay? Now, I talk a lot about the lightheadedness and ADD. That's low blood pressure in the brain. But you can have low blood pressure in the neck and scalp muscles. All right? And like in the scalp, with the exception of sinus headaches, it looks like this low blood pressure from autonomic dysfunction is probably your major cause for migraine headaches, cluster headaches, tension headaches. Okay? If it's not the head and it's the neck, it's called Coathanger pain. All right? It's called Coathanger pain because, these neck muscles here, okay, are kind of the shape of a coat hanger. And people get intense pain there. This kind of pain is unique in that after you're laying down for a while, or especially like you've slept through the night, you won't have this first thing in the morning, like before you get out of bed. Why? Because, so here's your head. If you're having trouble pushing blood up to your brain and your scalp and neck muscles, that's when you're in the upright position, especially if you're kind of sitting or standing still, like in a car or something like that. That's when you get coat hanger pain. When you're laying down, you don't have the gravitational problem, and you're able to perfuse the pressure, and your headaches and this Coathanger pain will go away. All right? Very common. If you have a spinal stenosis, which is a different problem from, say, arthritic spur pushing against your nerve, it's not about gravity, doesn't make a difference. You're going to have pain either position. Okay? And so most of these people have, or virtually all of these people that come to see me have autonomic dysfunction. And when you use the Nemechek protocol, so balance the gut, glutamine for COVID, fish oil, olive oil, and vagus stimulator, 4 to 6 weeks, most of all the headaches and Coathanger pain are gone because the blood pressure system is recovering. The autonomic nervous system is recovering. Okay? Now, what about some of the nervous system symptoms people get? There's a variety of nerves that come out here, okay, at this part, out to your basically the tops of your shoulders, arms, hands, up in the face. And when you have low blood pressure up in here, okay, those nerves it's called neuronal ischemia. They won't function quite right, and you can get these kind of fluctuating symptoms. Sometimes it's what we call tingle face, or in the hands, kind of comes and goes. Maybe a tightness that they feel comes and goes. Again, better when you're laying flat, worse when you're upright or standing still. Now, this isn't damage to the nerves, okay, this neuronal ischemia. This is kind of like when you cross your leg and your foot goes to sleep. That's from less, suboptimal blood flow. That's kind of the same thing here, okay? So you can get these neurological symptoms, you get this neck pain, and it is, unless you've been in a trauma, it is not craniocervical instability, all right? It's Coathanger pain from autonomic dysfunction. Plenty of other videos for you to watch in that regards. All right, that's all for today. Everybody, don't forget to hit the subscribe button. If you're looking for some good fish oil and olive oil, go to nemechekprotocol.com. Otherwise, everybody have a great day.